Welcome to the Kare For Kūpuna Podcast, where we dive into health, wellness, and vibrant living of our cherished kupunas. We are thrilled to take you on a journey exploring everything from health and wellness tips, deeply rooted in the spirit of Hawaii, to navigating the intricacies of retirement, preserving our rich culture heritage, and fostering vibrant communities for our elders.
Whether you're a kupuna yourself, a family member, a dedicated caregiver, or simply someone passionate about supporting and uplifting our elders, this podcast is for you. Each episode is crafted with love and the intention to inspire, inform, and celebrate the golden years. So sit back, relax, and join us on this meaningful journey as we care for our kupuna. Welcome to this episode of Kare For Kūpuna, where we care for our kupuna. I'm Trina.
And I'm Lani.
And we are your Kupuna Care Girls. This week's episode, we are going to touch on Extra Help, which is a government assistance program. And everything we're going to talk about today is referencing to 2024. And so the government assistance program, or Extra Help, it helps actually pay for your prescription drugs. It can help reduce down the costs or co-payments that you face when you pick up your prescriptions. And it also could reduce or eliminate your plan premium. So if you have questions and you want to see if you can qualify for this program, you can always reach out to us at www.careforkūpuna, care with a K.com, and we'll be happy to help you.
And also for this year, if you do qualify, if you've heard of the donut hole, that would be also not a problem for you because it will bypass the coverage gap. And also, if you have a late enrollment penalty, that also will be waived if you do qualify for Extra Help.
Yes. And Extra Help is like a way of saving money through your Medicare journey. And so you can actually apply for this program throughout the year, anytime. So when you feel like saving a few bucks, reach out to us and we'll be happy to help you apply for that. But, you know, there are guidelines that does qualify you for it. So for this year, you know, we don't want to share the whole information because we want you to reach out to us. But, you know, many changes are coming up in 2025 and we'll touch on those episodes. We'll touch on that in the next episode.
Absolutely. We definitely want to share that valuable information. And if eligible, there are different levels of qualification. So Medicare may pay up to 75% of your premiums, your annual deductible, co-insurance, co-payment. Again, that may change or will change in the upcoming year. Okay.
Yeah. And so we want to really share with you how this had helped several clients of ours that we helped with this, getting them this program. And so a lot of the clients I had helped, it's been really the same story for me. It's just that they're just super grateful that they now can afford their prescriptions. Now they don't have to decide which pill they can pick up based off of how much money they got left in their bank account. Now they can actually afford to pick up all of their prescriptions at a decent rate that, you know, that they can take on a regular basis like it should be.
Yeah. And, you know, we meet with clients and seniors all the time. And sometimes they'll come in with stories like, oh, I can't afford my medication. I did help this family in particular, and it really sticks with me since I first started. So I, worked with a cancer center, and they reached out to me and asked me if I could help this woman. And the daughter came in to meet with me. And she had asked me, Leilani, my mom can't afford this medication, but she needs it. And it was like $1,000 for this medication for cancer treatment. And I, sat down with her, did the finances, and we looked at the financials, and we applied online. And then 3 weeks later, I get an email from the cancer center saying that she did qualify, which is great news. So she's, on this medication. And then 3 months later, I received an email from the daughter, very touching. It was one of those emails that, like, it's in my heart that I always carry with me. I'm like, wow, that was so touching. She sent an email that was short but very powerful. She said, "Thank you, Lani, for helping my mom. She was able to take this medication, and we were able to spend 3 more months with her." So it always gets to me. But yeah, extra hope, if any of the seniors out there qualify, it really could really have an impact on your life. So sorry about that. It's just one of those things where, man, it really, really was like one of the best emails that I received. Mm-hmm. Yeah. So, but before we end the episode, we like to end it with an inspirational quote. Especially today. Today we end it with, "We should give our elders the respect and dignity they deserve, for they have made our lives possible."
Yeah.
So thank you, everyone. Thank you for joining us on another episode of Care for Kūpuna, where aloha meets wisdom, one podcast at a time. Ahui ho.
Ahui ho.
Mahalo for joining us on this episode of Care for Kūpuna, where we explore health, wellness, and vibrant living for our cherished kupunas. We hope you found inspiration and valuable insights.
Remember, your support can make a difference. 20% of all proceeds from our podcast go to a nonprofit organization here in Hawaii dedicated to helping seniors in our community. If you'd like to contribute, visit our website at www.careforkūpuna.com and make a donation.
Are you a brand or business looking to align with our mission? Consider sponsoring our podcast. Visit our website for more information on sponsorship opportunities.
For those with stories to share, we invite you to be a guest speaker on our podcast. Head over to our website to express your interest and become part of the conversation.
Last but not least, stay connected with us by subscribing to our email list and following us on social media at Care for Kūpuna with a K. Join the Care for Kūpuna community to stay updated on all things related to health, culture, and creating vibrant communities for our elders.
We appreciate your time and look forward to welcoming you back on the next episode of Care for Kūpuna.